As Taylor Ronke parks her car, gearing up for another run, the race she's currently training for feels different. She's no stranger to pounding the pavement. She signed up for her first race a decade ago.
After I crossed that finish line, I was hooked.
But 5 years ago, she didn't know if she would ever run again.
When I woke up from a nap, I couldn't move my legs. I thought, well, this is weird. So I was able to swing them off the bed. I tried to stand up and I fell down.
At about midnight later that night, it happened again.
And my husband had to put his arms under my armpits to help carry me to the bathroom.
She saw her doctor at Sanford the very next day. They ran blood tests.
And I wasn't even home for 20 minutes and I get a call from the doctor's office. You're a diabetic, you need to get to the ER.
Normal fasting blood sugars are below 100. 100 to 125 is considered pre-diabetic, and anything over 126 indicates diabetes. Taylor's was 550.
I felt like my whole world had just come collapsing down.
She said through this time, her family, and husband in particular, was her rock. Through highs and lows, she adjusted to the new normal, kept running, and put her name in the lottery for the 2022 Chicago Marathon.
There was a lady who tapped me on the shoulder. She's like, "Are you a diabetic?" I said, "Yeah." She's like, "Type 1 or type 2?" I said, "Type 1. She's like, "I'm so proud of you." I was like, this is why I run. This community of runners.
She's conquered every goal she's had when it comes to running, and running with diabetes. Today, she's got a new goal, PRing at the Sioux Falls Half Marathon, and she's enlisted the help of the Sanford Run Project.
Well, Taylor's a delight. She is a ball of energy.
Jenny Dolan is an athletic trainer at the Sanford Fieldhouse. She said the Sanford Run Project is a 12-week, multifaceted approach to training, starting with a 3D analysis of Taylor's running mechanics.
It gave her an idea of things that she could work on during this 12 weeks to improve her running form. And then I also found areas of strength or mobility limitations that she had. So she worked with Charlie in our strength and conditioning. And so he was able to build a greater foundational strength for her. So as she trained, she was also getting stronger.
Dolan said this type of multifaceted approach is what makes the program at Sanford unique.
In this building, we have experts in all different fields, and our goal is to get runners back to their sports safely. And we work together. So every person that comes in the door is going to get a customized program that's going to get them through that finish line.
The newest expert to the Sanford sports family is arguably the most important in Taylor's case. As a diabetic runner and athlete, nutrition is especially critical. She's been working side by side with senior sports dietitian Natasha Hansen.
Taylor's been so fun to work with. She always makes me laugh.
Carbohydrates are obviously a touchy subject for diabetics, but play a critical role in athletic performance. Hansen said Taylor's been incredible in finding the balance.
Every time I've met with her, she's filled out at least a 3-day food log for me so that I can take those intakes, analyze the nutritional profile of those intakes. I always do a 3-day average because every day is a little bit different.
Taylor said she's never felt this prepared before a race.
What's really great is knowing that all of these resources are available to anybody. It's not just the Sanford Run Project participant. It's not just me. Anybody can use these resources to get them ready for a race. And I am so grateful for this opportunity. When I found out they had picked me, I almost started crying.
In Sioux Falls, Simon Floss, Sanford Health News.